Welcome to A Lot to Grow Through. I'm your host, Artist Jardins, and this is a space of thoughtful conversations on healing, growth, and the art of becoming. Here you'll understand you'll have to grow through it, not just go through it. Today we're talking about flashbacks, what they are, why they happen, and how to come back to the present when you feel trapped in the past. Let's get into it. Let's start by distinguishing between two types of flashbacks because they're different experiences even though we use the same word. Memory flashbacks are what most people think of when you hear the word flashback. These are vivid, intrusive memories where you see, hear, or relive a traumatic event. It's like watching a movie in your mind, except you're in it. These are common in PTSD, particularly after single incident trauma. Emotional flashbacks are different. You don't necessarily see images or remember specific events. Instead, you're flooded with the emotions, body sensations, and beliefs from a traumatic time in your life, but without the narrative context. You might suddenly feel small, powerless, terrified, or ashamed, but you can't pinpoint why. You just know you feel awful, and it feels all-consuming. Here's why this distinction matters. If you don't know you're having an emotional flashback, you'll think something is wrong with you right now. You'll look for explanations in your present circumstances. You'll blame yourself or others for feelings that actually belong to the past. A memory flashback might look like you smell a particular cologne and suddenly you're back in the moment of terror. You can see it, feel it, you're there. An emotional flashback might look like your partner says they need space and suddenly you feel this crushing sense of abandonment, terror, worthlessness, but you don't connect it to being abandoned as a child. You just think, I'm unlovable. This relationship is doomed. I can't survive this. Same root, trauma, different presentation. I've experienced both types of flashbacks, and while both are disorienting, I have to tell you, emotional flashbacks are the ones that really get me. Reason being, emotions rule your entire being. When you're having a memory flashback, at least part of you knows what's happening. You can see the memory. You might recognize it as something from the past, even if you feel trapped in it. But emotional flashbacks, they're different. You don't have the context. You don't have the narrative. You just have this overwhelming flood of feeling. Terror, shame, helplessness, rage, and you don't know where it's coming from. And when your emotions are running haywire like that, you have the potential to lose control of yourself. That's what makes them so disorienting for me. Because emotions aren't just feelings. They affect everything. Your thoughts, body, behavior, sense of reality. When you're in an emotional flashback, you're not just remembering something bad that happened. You're feeling like you're that person again. That helpless, overwhelmed version of yourself from the past. And without the visual memory to anchor you, it's harder to remind yourself this is a flashback and it's not happening now. You just feel awful. And you start looking for reasons in the present. You start thinking something is wrong with you right now, when really you're just caught in a feeling state from the past. So yeah, I've experienced both, but the emotional flashbacks, those are the ones that have taught me how powerful emotions really are and how important it is to learn to work with them instead of being controlled by them. So why do flashbacks happen? What's going on in the brain? When you experience trauma, your brain encodes that memory differently than regular memories. Normally, memories are processed and stored in a way that's organized by time and context. You know what happened in the past, you can recall it without reliving it. But traumatic memories often don't get processed this way. They're stored in fragmented form, sensations, emotions, images, without the narrative structure or timestamp. So when something in the present reminds your brain of that unprocessed trauma, a trigger, your brain pulls up that memory as if it's current information. In the brain, your amygdala, which is linked to emotions, fear, and motivation, says, danger. This is happening now. Your hippocampus, which is supposed to provide time and context, says, wait, when is this from? But if the memory isn't properly integrated, the hippocampus can't answer. So your brain defaults to, it must be now. So the result? Flashback. This is why flashbacks feel so real. Because to your nervous system, they are real. Your body is producing the same stress response it did during the original event. Your heart races, you might sweat, you might feel the same terror or helplessness. So you're not imagining it, you're not being dramatic, your brain genuinely believes you're in danger. So now we know what flashbacks are and why they happen. The question is, what do you do when you're in one? The goal during a flashback is to help your brain distinguish between past and present, to bring yourself back to the here and now. These are called grounding techniques, and I'm going to give you several because what works for one person might not work for another. Technique 1, the 5-4-3-2-1 method. This is a sensory grounding. You're using your senses to orient yourself to the present moment. Name out loud, or in your head if you're alone, 5 things you can see. So the lamp, the tree, your hands, so forth. 4 things you can touch: the chair, your shirt, the table. 3 things you can hear: birds, traffic, your breath. 2 things you can smell: coffee, fresh air. 1 thing you can taste: gum, water, or notice a taste in your mouth. While this works, it forces your brain to engage with sensory information from the present environment, which signals we are here, not there. Technique 2, timestamp orientation. Say out loud, and seriously, speaking engages a different part of your brain. My name is your name. I am your age, years old. Today is day, month, year. I am in location, and I'm safe right now. Then add, what happened to me happened in the past. It's not happening now. And while this works, it gives your hippocampus the time and or context information it's missing. Technique 3, physical grounding. Feel your feet. Press them into the ground. Notice the sensation. Touch something cold. Ice, cold water, a cold can. The temperature can interrupt the flashback. Hold something with texture. A stone, a textured fabric, anything that requires attention to touch. Move your body. Stand up, stretch, walk. Movement can help discharge the activation. Trauma gets stuck in the body. Physical sensation brings you back into your body in the present. Technique 4, breathing, but not the way you think. You've probably heard, just breathe, and wanted to throw something. I get it. I've been told to just breathe, and the annoyance almost snapped me back into reality. Breathing advice during a flashback can feel invalidating. But here's a specific technique that's different. Longer exhales than inhales. Breathe in for 4 counts. Breathe out for 6 to 8 counts. Repeat for 2 to 3 minutes. Now, this works because longer exhales activate your parasympathetic nervous system, the rest and digest response. It psychologically calms your body down. Technique 5, self-soothing talk. This might feel awkward, but it works. Talk to yourself like you would talk to a scared child. You're safe. I'm here with you. This is a memory. It's not happening now. You're going to be okay. I've got you. And while this works, it engages your prefrontal cortex, the thinking brain, which can help regulate the amygdala, the fear brain. So I've tried pretty much all of these grounding techniques, well, all except physical grounding. I haven't really gone the cold water or textured object route yet, but the 5-4-3-2-1 sensory thing, timestamp orientation, breathing, self-talk, yeah, I've tried them all. And I've learned not everything works for everyone, and that's okay. The 2 that actually work are breathing techniques and self-talk. Breathing works because it slows down the acceleration of my body. When I'm in a flashback, my body is going, heart racing, adrenaline pumping, everything amped up. And the breathing, especially that longer exhale thing I mentioned, it physically calms that down. It's like telling my nervous system, hey, we're okay. Let's slow it down. Now, self-talk works because it reminds me of reality. I give myself that real talk. I'll say out loud, this is a flashback. This is not happening now. I'm safe. And hearing my own voice, speaking those words in the present moment, it helps anchor me. Now, the 5-4-3-2-1 sensory technique, that doesn't work for me at all. And that's because my ADHD deters me every single time. I'll start trying to name 5 things I see, and by the time I'm on the second thing, my brain has already wandered off to think about something completely different. It's not grounding me. It's just giving my brain more things to jump between. So I had to accept that technique might work great for some people, but it's not for me, and that's fine. The point is, try different things. See what works for your brain, your body, your nervous system. Don't force something just because it's supposed to work. And when grounding is working, here's what it feels like for me. It feels like an adrenaline rush gradually coming to a halt. Like you're in this intense acceleration and then slowly you're decelerating, coming back to baseline. That's how I'm coming back to the present. The intensity lessens, my breathing evens out, and I start feeling like myself again. Okay, so you've used grounding techniques and you're back in the present. So, what now? First, be gentle with yourself. Flashbacks are exhausting. They take a physical toll. Your body just went through a stress response. So you might feel drained, shaky, emotional, or numb, but that's normal. Second, don't judge yourself. You didn't choose to have a flashback. It's not a weakness. It's your nervous system doing what it does after trauma. Avoid the spiral off. The why did this happen? I thought I was doing better. I should be over this by now. That's shame talking, and shame makes everything worse. Third, process it when you're ready. Not immediately, but when you're regulated, it can help to journal or talk to someone about what happened. What triggered the flashback? What did you feel? What helped you come back? What do you need now? If you're working with a therapist, bring it up in your next session. Flashbacks are valuable information about what still needs processing. Fourth, rest. Seriously, your body just went through something. Honor that. So let's talk about what happens after a flashback, because this is just as important as getting through it. Immediately after a flashback, I'm emotional. What I learned about myself is when I'm having a moment like that, I just need to be left alone. I don't need someone trying to comfort me. I don't need someone asking a million questions. I don't need someone telling me it's going to be okay. I need space. I need quiet. I need to process what just happened without anyone else's input. In the aftermath, I need to process what happened alone and without unrequested opinions or commentary. And that's huge for me. What makes it worse is when people try to fix it or explain it or tell me what I should do. I don't need that. I need to sit with it myself first. Now, what does my post-flashback care actually look like? Honestly, it's not elaborate, and I don't have a whole ritual. I just give myself time. I sit with whatever I'm feeling, and I might process it internally or I might not. But sometimes I just need to be for a minute without trying to analyze everything. And thankfully, it doesn't take me that long anymore. It used to take hours, sometimes days, to feel normal again. But now, a few minutes, maybe 10, 15 minutes at most. And that's because I've done the work to lessen the time it takes to snap back. I've built the frameworks. I've practiced grounding. I've learned what I need. So now, when a flashback happens, I can move through it faster. I can recover faster. It doesn't have to take forever. The more you practice, the more you understand yourself, the quicker you can come back. But in that immediate aftermath, honor what you need. If you need to be alone, be alone. If you need to call someone, call someone. There's no right way to do this. Just don't abandon yourself. Don't push through like nothing happened. Your body just went through something. Tend to it. I want to address something directly. If you're experiencing flashbacks, you might worry that you're going crazy or losing it. You're not. Flashbacks are a recognized symptom of trauma. They're documented in the research. They're part of PTSD and CPTSD diagnostic criteria. They're not a psychosis. They're not a sign you're broken beyond repair. They're your brain's way of saying, this trauma hasn't been fully processed yet. It needs attention. And here's something important. Flashbacks can actually decrease with trauma-focused therapy. Modalities like EMDR, eye movement desensitization and reprocessing, CPT, cognitive processing therapy, and trauma-focused CBT, cognitive behavioral therapy, have strong evidence for reducing flashback frequency and intensity. The fact that you're having flashbacks doesn't mean you're stuck with them forever. It means there's work to do. And that work is possible. I won't tell you flashbacks will never happen again. For some people, they become rare. For others, they happen occasionally throughout life. I'm part of the occasional group. But what changes is your relationship to them. You get better at recognizing them. You get better at grounding yourself. They become shorter, less intense, less terrifying. And most importantly, you stop believing them. You stop believing you're back there. You know it's a memory, not reality. So let me tell you how my flashbacks have changed over time. They're less frequent and way less frequent than it used to be. And that didn't happen by accident. It happened because I identified what triggers me, and I built frameworks to either process the flashbacks or prevent them from happening in the first place. Now, I want to be clear. I didn't go to traditional therapy for this. What worked for me was doing the work on myself through trial and error. I tried different things. I paid attention to what worked and what didn't. I tweaked practices until they actually fit me. That's what made the difference. And my current relationship with flashbacks is completely different than it used to be. I can recognize them faster now. The second I start to feel that shift, that emotional flood, or that pull backward in time, I know what's happening. I don't spiral into confusion anymore. And I can handle them a lot better now. I have the tools, I have the awareness. I don't panic when they happen because I know they're temporary. So if you're in the thick of it right now and flashback feels constant and overwhelming, I want you to know it can change. Not overnight, not without effort, but it can change. You can get better at recognizing them, and you can get faster at grounding yourself. You can reduce how often they happen. It takes work, but you're already doing the work by being here, by learning, by trying. So keep going. It gets better. Flashbacks, whether memory-based or emotional, are one of the hardest parts of living with trauma. They collapse time and make the past feel present. But they're not evidence that you're broken. They're evidence that something happened to you that hasn't been fully processed yet. Grounding techniques can help bring you back, and trauma-focused therapy can help reduce how often they happen. More importantly, you're not losing your mind. You're experiencing a normal response to abnormal events. If you're struggling with flashbacks, please consider reaching out to a trauma-informed therapist. You don't have to do it alone. So here's what I want you to walk away with. If you're experiencing flashbacks, the first thing you need is language. You need to understand what you're experiencing and be able to name it clearly. That's what this episode is for. Because when you can name it, when you can say, I'm having a flashback, instead of, I'm losing my mind, that's power. And here's something I want you to hear. Living in the past through flashbacks isn't completely bad. I know that sounds strange, but it's true. Because not every flashback is traumatic. Sometimes they're good memories. Sometimes they're your brain processing something that needs attention. The key is understanding what it truly means and recognizing that sometimes you can't control when they happen. And that's okay. My relationship with flashbacks has changed over time. They still happen. I'm not going to tell you they disappear completely, but they're less frequent now. And what's really changed is how I handle them. I've learned to allow myself to experience the moment. I don't fight it. I let it happen. And then I come back to reality without letting it negatively affect me. I've learned how to maneuver through flashbacks, both the good ones and the difficult ones. What gives me hope when they happen is I know it's a past experience. I can differentiate between the flashback and reality. And I remind myself that every flashback isn't negative. So when you're in the middle of a flashback and you're trying to ground yourself in the present, remember when you ground yourself, nothing can deter your mind from staying with what's real. So talk to yourself. Seriously. I do it. Say it out loud. Whatever works for you, use them. Remember to learn to understand the different types of flashbacks and how to maneuver through them while staying in control. I will always advocate for therapy. Always. If you're struggling with flashbacks, please reach out to a trauma-informed therapist that can help you process what needs processing. But also, be patient with yourself. Give yourself that grace. This is hard work. And if the grounding techniques I talked about in this episode work for you, practice them. If they don't, find what does. The hard underlying truth is flashbacks are the subconscious operating in the way you're allowing it to. You have way more control than you think, not over whether they happen, but over how you respond when they do. They're absolutely a sign that healing is needed, but they're also temporary, even when they feel permanent. And flashbacks and healing work, they go hand in hand, and you can't do one without encountering the other. So if one happens today, tomorrow, next week, you're going to be okay. You know what it is now. You know you're not losing your mind. You know how to ground yourself. You know you can come back. You're stronger than what happens to you. You're stronger than the past trying to pull you back. And you're not alone in this. If you have experiences with flashbacks and want to share or have questions about what we talked about today, you can submit them to letters@alottogrowthrough.com as either an email or a voice message. Also, check out alottogrowthrough.com for more information on the podcast. If you enjoyed this episode, please subscribe. The podcast and future episodes are available on Apple Podcasts, YouTube, Spotify, wherever you listen to podcasts. Until then, remember, healing isn't linear, and you're doing better than you think. I'll see you next week.